Hey, Sarah.
Hi, Dr. Fleischer.
Hey.
We want to welcome everyone to this Rush Recaps video. Rush Recaps are a short educational series intended to help address some of the common questions or concerns that we hear from patients, families, and care partners here in the clinic. This project is supported through a grant from the Parkinson's Foundation and grant support from the National Institutes of Health. And so we want to welcome you, Dr. Fleischer. Thanks for being with us.
Oh, it's my pleasure.
I'm wondering if you might be able to help provide some more information about a question we often get from patients and families about what to do if their loved one is hospitalized.
It's a really great and really important question, Sarah. I think one of the first things to think about is why would people with Parkinson's or movement disorders be hospitalized in the first place? And it's often not something necessarily directly related to their Parkinson's, for example. So very few times do people get hospitalized because of a tremor, right? But the main causes of hospitalization in people with Parkinson's and other movement disorders are falls that lead to an injury or a fracture, like breaking a bone, an infection, especially urinary tract infections, pneumonia or an aspiration pneumonia, where they swallow something down the wrong pipe and that leads to a pneumonia in their lungs, or worsening of some of the neuropsychiatric symptoms. So, like worsening of agitation or depression or hallucinations or delusions. So, those can be some really common reasons for admission, as well as dehydration. Um, and so, we often will get a call from family saying, I think I'm taking my loved one, to the hospital. What do I need to do? Right. Um, and so one of the things that we try, if we know that someone is on their way to the hospital, hasn't left yet, or to tell people now when that's hopefully something, in the future, if it ever happens at all, is there's certain things that you should actually bring with you to the hospital. So kind of like thinking about a pregnant lady who's got that to-go bag ready to go into labor, right? So there's something awesome. So if you don't have one of these, it's the show and tell portion of today's video. So this is a hospital care kit or a wear and care kit from the Parkinson's Foundation. This is fantastic. Inside of here, there is, let's see, um, well, you can place the name and contact information of your neurologist inside of this bag. There are medication lists, so keeping an accurate, up-to-date list of all the medications you take, so you can hand that over to the team in the hospital. There's a little silver bracelet that says, I have Parkinson's, that you or your loved one may want to wear. There's also a really important set of tear-off sheets. These happen to be in Spanish, but these sheets tell people here are medicines that are safe for a person with Parkinson's or related disorders, and here are medicines that are not safe. So, for example, there are some medicines that are commonly given to people who are agitated, especially in the emergency room or hospital settings. And some of those medications are not safe for people with Parkinson's. And so, if you or your loved one is ever hospitalized, if they're agitated, if someone brings up, we're going to give them something to quiet them down or to help them calm down, you can always ask. And if someone says, no, 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 well, this is what we usually give, these sheets that you can bring with you help you be a great advocate. It's not just you being the squeaky wheel. This says the Parkinson's Foundation, my doctor says I can't have these medications. Um, Anything I missed on that, Sarah?
We've heard from some families that they'll ask the hospital to put those in their loved one's medical record as an allergy so that, again, it's just another double check in case someone tries to order one of those medicines, that the system will kind of ping them on the back end as a way to, again, alert them that there could be a contraindication or a side effect that we'd really prefer to avoid.
Exactly. We'd rather prevent it than, try to handle the consequences after. Um, I think the other thing to know about hospitalizations, so there's a lot of studies that have actually shown that despite people with Parkinson's and their care partners advocating really strongly when they're in the hospital, It's very common. So about 75% of people say that there was some kind of error with their Parkinson's medications. Usually this has to do with timing of medications. And it's not that the hospital staff doesn't care. It's not that they're not listening. The challenge is that most medications, timing is not so super sensitive. So if you take a blood pressure pill or a cholesterol pill, for example, or your daily multivitamin, does it really matter if you take it at 8 a.m. or at 4 p.m.? Not really. But does it matter if you're someone who takes levodopa frequently throughout the day? Does it matter if you're an hour or 2 hours late for your usual dose? For most people, it absolutely does, right? And so it's really important. And we want to empower you to be able to speak up when you're at the hospital. If you or your loved one is not getting their medications on time, please share with the healthcare team. This is my usual schedule. I need the meds at these times because that helps me function. That helps me be able to eat. I'll be able to participate in physical therapy if I'm on and my meds are working, right? What we don't want to happen is, someone's tray of all that delicious hospital food is brought to them first thing in the morning when they don't have any medications on board and they may really struggle to get that nutrition in. And the medications are dropped off later, right? That doesn't help. And so make sure that you advocate. The team may be super busy. The nurses may be covering many, many patients. And so they may not be able to give it to you exactly on time, but explaining why you need it and how getting your meds on time can help you function as best as possible will help you ally with the healthcare team and help you get what you need and hopefully get you recovered and out of the hospital as soon as possible. The other things to think about. So we often get called or we'll get a message in the healthcare portal in my chart saying, my loved one is admitted to XYZ hospital. Can you talk with the team or can you come see them? So unfortunately, most hospitals, while they may have a neurology consult team, that doesn't necessarily mean that they have a movement disorders person. At Rush, we're quite unique. If you're admitted at Rush, you can ask for a movement disorders consult, and one of us and our fellows will usually come and check in on you and make sure that things are going well. But at other hospitals, if you are not being seen by a neurologist, you can always ask for a neurology consult. And you can certainly ask your medical team to reach out to your neurologist to run any changes by them. So we unfortunately don't have privileges at other hospitals. We can't tell the other hospital what to do unless they ask us for recommendations. Sarah, is there anything else that you can think of that we're missing about hospitalizations, things that we get asked frequently?
Yeah, the other question we sometimes get is, what should people know if they're having a planned surgery? So some of those comments you were mentioning were kind of more emergent things where we're kind of picking up and heading to the hospital quickly. But are there other things we need to think about with a surgery?
It's a really great question. So some medications, some docs may want to hold or have you sort of wait on taking depending on the surgery that you're having and the anesthesia plan. And you are not expected to know that, but sometimes the surgeon or the anesthesiologist might recommend certain things or may want to speak with your treating neurologist. So that's something that if you're talking about a planned surgery, you can always ask the surgeon or ask the anesthesia doc, you know, do you want to talk with my neurologist? Is there anything that you anticipate I'd have to do differently with my medicines? Right. The other thing is sometimes, we can write letters and say, please, if possible, take this person for surgery, as early in the day as possible, because many surgeons don't want you to have anything by mouth at all, including even your pills before surgery. Some, depending on the surgeon and the surgery, will be a little bit more lenient. So you may be able to take your morning pills before surgery. Other times, you may not take anything in the morning. And then typically we will say your levodopa, some of the other medications, as soon as you've recovered from surgery, as you're awake and alert and it's safe for you to swallow, you kind of get back to wherever you'd be in the day in terms of your timing of your medications. You don't need to catch up for multiple doses that were missed.
That's really helpful. Thank you so much, Dr. Fleischer.
Absolutely.
Is there anything else? I think we've covered all of it today.
I think the only remaining thing that I know I get asked a lot is, someone will be hospitalized or have a surgery and call a day or so later and say, I'm not feeling quite back to myself. And so the rule of thumb that I was taught was for every day in the hospital, plan for 1 week to recover. So if you are, in and out for a surgery, still anticipate that you might not be back to your normal routine for a full week, and that's okay. And it doesn't mean that this is a decline in your Parkinson's or your movement disorder. It just may take you a little bit longer to recover. If you're in the hospital for a prolonged hospitalization, ask about going home with home health, with home therapies to help you recover sooner, because it can be quite a bit of time before you get back to your pre-hospitalization baseline. And if at all possible, we want to be on the lookout and prevent those things that cause hospitalizations, prevent the fall, prevent the urinary tract infection, or catch it early as an outpatient and treat to try to prevent all of that in the hospitalization in the first place.
Such great points. Well, thank you so much, everyone, for joining us for this Rush Recaps video. Continue to check out the growing library of other educational content on the Rush Movement Disorders patient education page. And if there's other topics you'd like us to share, please send an email or let your physician know at your next visit. But with that, thank you so much and have a great day.
Thanks.